Hello, this is Kate Sanders with the OSU Alumni Association. Thank you for joining us today into our podcast, The New Way to Travel. Today we're going to talk about where we can travel right now, what the trends are, and what we are seeing in the travel industry and changes and what to expect as you head out. First, I want to say that all this is changing very fast. So the information that I have today might very well change tomorrow. But 1 minute a country may be open and the next they actually may close their borders. But that said, this is where we are today, and welcome to the New Way to Travel. This podcast or webcast is being recorded and you'll be able to view it online afterwards as well. Joining us today, we have Julie Schwartz. She is our OSU Alumni Association Associate Executive Director. And from the USI Travel Insurance Services, we have Angel, Myron, and Karen. All of them are going to be available in the Q&A box. You'll see that at the bottom of your screen. If you have a question during this presentation, feel free to type it into that box, and one of them will answer your questions. Let's start by getting to know a little bit about our audience with an audience poll. My colleague Mary is also with us today, and she will pop the poll up for us. And the question you'll be asked as soon as you see it here in a minute. There you go. You should see a poll pop up. Are you considering booking an international trip in the next 6 months? We've got yes, as soon as I can, get me out of here, maybe, but I'll probably book last minute. And no, not until I can teleport, or at least, if there's a vaccine or better cures for this. So we'll give this a minute, allow folks to answer. We got most of you going through right now. Great, just a few more minutes. I think we'll allow that. We'll go ahead and end the poll. Mary, do you want to end that for us? And then we'll bring up the results. So you should see the results on your screen. Yes, we've got about 19% of you are ready to get out of here. 35%, well, probably, but we'll book last minute. And then the majority of folks, 45%, we're going to wait and see if how things go. Wonderful. Okay, let's stop sharing that poll, and we'll keep going on. So for those of you who do want to head out or are planning to head out in the future, I want to first say, please visit these two websites, the U.S. Government Travel Advisory site, as well as the Center for Disease Control website. You've probably heard that the U.S. government has lifted the global level 4 travel advisory. So now we're back to country-specific advisories. But a notice about the advisories, a low advisory like a level 2 doesn't give you a green light to go to that country right now. For instance, New Zealand is a level 2, but they have closed their borders to everyone except New Zealand citizens and New Zealand residents with valid travel conditions. So check all country regulations and entry requirements, as yes, as I said before, this information is changing often. Be also sure to check with your travel insurance company and make sure they will cover you in that country in which you wish to travel. Another tip, my colleagues and I like to check UK's travel advisory website as well as Australia's. We find that they do a very good job at describing what the concerns may be in countries all over the world. So there's another resource for you. To keep you engaged, I've got another poll. Are you planning to travel a trip in the United States in the next 3 months or so? Mary, why don't you launch that one? I'll give it here a minute. Okay, should be launched on your screen. No, I don't think so. Why, yes, of course. I'm going to travel around locally maybe, and perhaps, maybe I'll travel. Great, that one. We've got most have answered. And the voting has slowed down, so let's go ahead and end that poll. And you should be seeing your results here in a minute. It looks like a majority are yes, let's go travel around the US. And then we do definitely have some no's and some maybes in the group. Wonderful, we can stop sharing those results. If you are traveling within the US, be aware that there are restrictions on certain states, and certain states have asked travelers to self-quarantine. Here is a list of what those states are. So be mindful of where you're going if you're traveling in the US. If they don't want you there, my advice is not to go there. But where could you go internationally? Here are a list on the left side. These are countries where you can go that you do not need a COVID-19 test, but other restrictions, of course, may apply. And then on the right are a list of countries that you can travel to with US passport holders, that is. But you must provide a negative COVID test and possible other restrictions before traveling. And again, this list was valid as of August 7th, just recently, and it could change. And be sure, again, to check with that travel insurance company. Notice about the levels, you'll see here on these lists that I have Croatia level 3. Those, again, are your travel advisory levels. It is government-backed advice. If you want to travel to Mexico, for instance, this is a level 4. Level 4 travel advisories can affect your travel insurance policies, so know the requirements. Where can you go if you're willing to do that 2-week quarantine upon arrival? The list is on your left. And the list on the right are countries that will be opening soon. Canada is definitely the topic of conversation. Lately, there have been some Americans that have been trying to sneak into Canada on their boats, saying that they're going to Alaska, but spending some time in Canada. They are catching those people, so please do not try to sneak into Canada. The word on the street is that sometime in fall or early winter, Americans may be able to go back to Canada, but most likely with a quarantine restriction. So things are slowly trying to open up, but it's still taking some time. Some travel trends. This is what we're seeing today. We're seeing that travelers are waiting last minute to book trips, just waiting to see if it's safe, if it's a place to go, and if things are changing. This makes a lot of sense. People are looking at less crowded areas, adventure vacations, going to the beach, nature, wellness retreats, as well as luxury travel or those weekend resorts at a luxury resort. A lot of this is trying to stay within what we're calling a travel bubble, so to reduce your impact with others around you. And we're also seeing, of course, with domestic travel, a lot of camping, eco-pods, rentals, so that is happening. Digital travel, believe it or not, I'm putting it on the list because folks are opting to stay home but still want to see the world, and there's some wonderful websites out there that you can visit and see a lot of countries. Who's traveling? We are seeing families, especially that domestic travel, and Generation Z and Y. Those are right now traveling more than anyone else. There once was an idea about an immunity passport to be able to get into certain countries. That is going away because we're finding that the immunity to the COVID virus is not lasting very long. Rapid COVID-19 tests are at airports. The world's first airport for a mandatory COVID testing was in Hong Kong. Once you arrive, you're sent to a designated testing site and you are mandated to wait there for the test results. In May, a traveler did have to wait 8 hours for their test results. It's getting better. In Tokyo, international inbound travelers only have to wait about 2 hours for their COVID tests. In the United States, there are about 15 airports that international travelers that are returning to our country, they have to go through. U.S. Customs and Border Protection works with CDC, and they provide additional health screening upon arrival. and you will also be asked to immediately quarantine for 2 weeks when you return home. You will see a lot of signed waivers, health questionnaires. You'll be asked multiple times, have you been in contact with anyone with COVID? Do you have any COVID symptoms? Some folks were concerned with these questionnaires that they were a HIPAA violation. They're actually not a HIPAA violation, and that is because it's our choice to choose either the travel provider or the airline. And it's your choice not to go with them if you don't want to fill out their questionnaire, but you will see questionnaires everywhere you go right now. Travel insurance requirements is starting to be a thing. There are tour companies that'll say that you need to have a minimum level of insurance before you go out on the tour. That's more medical insurance instead of travel cancellation insurance. We'll talk a little bit about that as we go further, but don't be surprised if you start seeing companies require a minimum level of medical travel insurance. Tracking bracelets and devices. You may have seen these on the news. They're coming and going in popularity. Not so much in the United States, but in other countries, there are wearable tracking devices that can track whether or not you have some COVID symptoms or if you've been around others that have tested positive for COVID-19. We do have one university, according to Inside Higher Ed, Oakland University, they're implementing a volunteer project. It's called the Bio Button that students will wear. And this Bio Button will be able to go back, the information back to a database if somebody's starting to get some COVID symptoms. And then they'll be able to go through and see who that person was in contact with. There's definitely issues with privacy and comfort levels with this technology. And as I said, it's easier to deploy in some places over than others. Singapore, they have a trace together token wearable device. Same sort of thing. If you become sick, the government can download the data and get that contact tracing information. I don't expect it to be a widespread practice here in the United States. Masks, masks, masks. We definitely need to be comfortable wearing a mask. We'll see it everywhere. My kids actually are able to go to a small group day camp and they're wearing masks all day, every day. So they're getting used to it now, which is great. More so than I am, believe it or not, because I don't hardly leave my house.
Kate, can I interrupt for 1 second? This is Julie.
Yes, we have Julie Schwartz here, and she's
Alumni Association. We just had a couple questions about the quarantine, and I thought you might want to take a little deeper dive.
Sure.
So one of them is about the UK. Is that something you can do in a personal residence, or is that a quarantine center for 2 weeks? I think it's personal, but can you confirm that?
Yes. And you know what? It even gets more complicated because it depends on which country in the UK. Because the UK does have an overriding mandate to quarantine, but is also given the ability for each countries within the UK to decide what that looks like. So it will be different from Slovenia than it would be from Germany or from any other country. So you do have to dial down into what that specifics regulations are. And a lot of times what it comes down to is you have to have a place, whether it's a hotel or a residence, and you have to declare what that location is.
Right. And can you leave that place to pick up food? In most cases, for 14 days, I assume you have to, if you have medication or you need to get food.
That again is a strict quarantine, and it would be country specific, but in most cases you're there. So if you're planning on going, you have to have all of that set up for you, or you have to figure out food delivery or someone to bring it to you if you know someone. So that's why we're seeing a lot of the only people traveling might be those that are seeing family. So if they have to quarantine, they know people that can bring them the supplies that they need. It's not easy.
It's not easy.
Not easy.
Yes, thank you for those questions. I hope that
you're welcome.
That up.
They're good questions. They're definite good questions.
Okay, we'll just move on. Thank you.
You're welcome. So the vaccine, the golden ticket. Is it going to be the golden ticket? Gosh, we hope it's going to be the golden ticket. On Tuesday, Russia's new Sputnik V vaccine was approved, experimental vaccine, and there is a lot of controversy around it. It hasn't undergone large-scale testing, so we're going to wait and see how this turns out. And one little bit of good news for world travelers out there, according to CNN, immunologists are finding that if you have been vaccinated against other diseases, such as influenza, hepatitis, tuberculosis, you may have a lower risk of getting COVID, and your body may be able to fight the disease a little bit better. So all of us that are global travelers who routinely get vaccines for going to a variety of different places, we may have a little bit of a running start. Whether that choose to be true, I don't know. Hopefully it's not fake news, but you never know. So we're all watching for that vaccine. We mean the world is working together, hopefully, to get this, and that might be our golden ticket. So we have one other audience poll here. Once international travel opens, where do you want to go first? We have our options. Mary, you can go ahead and pop that poll up. I'm staying put for a while, somewhere in the US, somewhere else in North America, maybe South or Central America or the Caribbean, Europe, Asia, South Pacific, Asia Pacific, Australia, Africa, or the Middle East. Maybe you want to go to Antarctica next year. I mean, there is the solar eclipse happening. Or, I just have no idea where I want to go. That's always an option. Or I can't decide. So many places. So we'll give a few more minutes here for folks to answer the poll. I will say it doesn't look like many people are staying put for a while in terms of preliminary results. Okay, our voting has slowed down, so let's go ahead and end the poll. And it looks like everyone wants to go to Europe. Well, not everyone, but a lot of people want to go to Europe. That's great. And of course, the United States, and that's what I was expecting. Tahiti and South Pacific, that's where I want to go. I love that place. Great. Okay, we'll clear that one off our screens, and we'll keep going in our presentation. A little bit about the new experience when you travel. I want to say is do your research. And one idea definitely is to rely on the professionals. No matter who you use to help you book your travel, one of the travel professionals will really help you figure this out. If you can go there, what to expect when you get there, and what the regulations may be. Some of these new experiences are not really new, but we're just going to need a lot more patience, a lot more understanding. Everyone, we're all going through this together. It's not easy for anyone working in the travel industry right now, whether or not you're with TSA or on a plane or in a hotel. Um, it's a pretty tough thing for everyone. Definitely obey all the rules and be flexible and expect delays, especially if you need to fly in the near future. Flights are getting rerouted. We're getting cancellations as multiple times. I had a colleague that had to go up to Alaska, and her flight was changed about 6 times before she left. Bring something to occupy your time. Now you might be waiting a little bit longer. Boarding process is going to take a little bit longer. If you have lines in TSA, you're very far spread apart, and that process will take a little bit longer. So definitely bring your portable chargers that you have, spare batteries. I love bringing pens, colored pencils, and like drawing books and books on tape, something to read, podcasts, movies on your device, but of course be mindful of how much data this stuff takes up. I always suggest dressing nice when you travel, but dress comfortably and in layers is the best bet because you don't know how long you might be waiting around. Another trend in traveling that you will see a lot is touchless technology. Traveling without a smartphone has now become much, much harder. We do have a lot of individuals that travel with us with the university that don't like to bring their phones and their devices, but that's going to be a lot harder now. Touchless really means that you're only touching your phone and doing a lot of checking in on your phone and then reducing contact with many, many other services. So if that's you check into your flight on your device, which we have been doing now for a little while, but more and more, they might send you a QR code, and instead of going to the airport and typing in your information in one of those kiosks to get your boarding passes, you'll simply hold up that QR code to the kiosk and your information will pop up and you can print your boarding pass and your luggage tags. You will probably be asked to hold your own paperwork, your own passport, your own boarding passes, and the officials will look at them, a lot of times through plexiglass. Hotels have online check-in and apps to save some room on your phone, because the hotels have apps now where you can use keyless entry. You hold your phone up to the key lock at your door as well as in the elevator. You can check in and check out on the app on your phone. I did this recently in February and it was slick. I liked it a lot. I had to start the app a few times, but it still worked. It was great. And of course, restaurants around this area and all over the world, you can order food and pay for your food through app service as well. So definitely smart technology is now the future. Other things you will see, as we mentioned a little bit before about those tracking ID bracelets, we're going to keep an eye on that and see if travelers have to do more of that when they go to certain countries. You might see Roomba-like disinfecting devices, drone luggage delivery. I haven't seen it yet in person, but there's conversations around it, as well as UV ray disinfecting and virus killing robots. So all this may be still hovering in the future, but it's being talked about. As I mentioned earlier, face masks. Expect to wear one and bring a few with you. You'll want to check the local regulations and follow them. Right now, we're even seeing shirts with matching face masks in stores, which is pretty funny. The rules are not the same everywhere you go. Most European countries have a mandate for wearing them on public transportations, but when you go into a shop or another indoor venue, it's gonna vary greatly. In Germany, you'll actually be fined for noncompliance, but Norway and Sweden, there's not a requirement. We did have a question ahead of time about N95 masks, cloth masks, medical masks. The thicker and the smaller the fabric pores are obviously best. If you are on our travel community Facebook group, I just recently posted a study that UC Davis did on face masks, so you want to check that out. They also found that N95 masks, yes, are the safest, but they are the hardest to get. So what I say is just have something. Um, Also, airlines. The airline requirements, of course, are also varying. One example is Alaska Airlines. Passengers ages 2 or older must wear a mask, and there's absolutely no medical exemptions. So if you have a medical reason for not wearing a mask, unfortunately, you're going to have to choose a different airline. You also, on Alaska Airlines, are not allowed to wear the masks that have those direct exhaust valves. You might see the mask with a little device here on the corner. Those will not be allowed on the plane. Face shields without masks underneath won't be allowed either on Alaska Airlines. You must have a face covering that covers the nose and the mouth. But other airlines aren't as strict. Um, in terms also, when you're traveling, if you might have been familiar with riverboat tours and on group touring, a lot of times we have audio headsets that you wear so you can listen to the guide. One tip, if you wear glasses like I do, and if you have a face mask on and it wraps behind your ears, and then you might have a hearing aid, or you might have one of those audio boxes on, that's a lot hanging off your ears. So try a couple masks on, see what's most comfortable for you. It might be a version that ties behind your head instead of around your ears. I definitely want to take that into consideration. For flying, you will definitely see in the TSA lines physical distancing in the lines. Again, as I said, you'll probably hold your own documents. You'll see the TSA agents in masks, gloves, and shields. You will be asked to remove all your food from your carry-on device and put it in a separate bag. Those can be triggers on the security machines, and they don't want to touch your bags, at least as very little as possible. So they're asking for all food to be removed from your carry-on bag. What's new is you're allowed now to bring a 12-ounce bottle of hand sanitizer. Every person is allowed a 12-ounce bottle of hand sanitizer in your carry-on luggage. So that is new. You will see temperature checks. And you could, if you have an elevated fever, you will be turned around. So if definitely want to make sure that you're feeling well before you even attempt to fly. About 70% of the airports in the United States are requiring masks right now. And majority of all airlines are requiring masks. Again, you'll have to fill out that document and to be routinely asked, are you COVID positive? Have you been around someone that's been COVID positive? You'll hear it over and over again. Boarding will take a little bit longer. They're boarding the planes from the back to the front to help reduce that contact. They're removing the seat back items in behind the seats, and there are no seat configuration changes, so they didn't physically change or alter the airplanes, but there are companies that are still doing the middle seats vacant, which are great. Delta is flying at about 60% in the main cabin and 50% in first class, and that's allowing for that physical distancing on the plane. American Airlines is not there, and they're not blocking middle seats, but they're opting to notify travelers if your plane is more than 80% full. They'll let you know and give you the option to change your flight. The airlines have HEPA filters in them, the airplanes do. According to American Airlines, the HEPA filters capture at least 99.7% of airborne microbes. The filters do purify the air on the inside, and fresh air is brought in through the engine compressor, and the two are mixed together. So the air is being recycled and cleaned very often. The airlines do believe that the leisure travel business will bounce back first, and that business travel will definitely be lagging behind. They also understand that flexibility is the key right now. So as much as they can, they're being flexible with passengers. They're trying to relax their cancellation policies. You have probably seen some really great deals flying right now, but don't expect those to last. Everyone says in the industry they're keeping an eye on those deals, and especially at hotels as well. You might save a little bit of money now, but as soon as possible, those prices are going to go up, and they'll probably be more expensive because this industry has been hit so hard. They need to make money back. A snapshot in time on that. I think this is really interesting. On April 12th, 2020, so this past April, TSA saw 90,510 passengers go through. A year ago, on April 12th, 2019, they saw 2,446,801 travelers. Huge difference. The the good thing to know that last week, our numbers are rising. Last week, TSA saw an average of about 700,000 travelers a day. That's much higher than 90,000 on April 12, but 700,000 is still a lot lower than our average around this time of year, which is about 2.2 to 2.5 million a day. We had a question about how clean planes are, and really, is it safe? Bloomberg.com, on August 5th, there was an article that was posted, odds of catching COVID on a flight are slim. A professor in the management of science at the Massachusetts Institute of Technology, his name is Arnold Barnett, he did a study. He found that there's a 1 in 4,300 chance of getting COVID-19 on a 2-hour flight. And then if that plane had middle seats open, you would even have a lower risk, 1 in 7,700 of getting COVID-19 if you didn't have the middle seats full. So what's more risky definitely are the crowds and the tightly packed lines. Some other tips are to drive your car to the airport instead of taking an Uber or a Lyft, because that will reduce your contact with others. And avoid flying at crowded times. So fly at those odd times, which is not a comfortable situation, but you'll see less people at midnight than you will at 8 a.m. Some other tips for flying, definitely be current on your routine vaccinations. Wash your hands. Avoid touching your face. Stay away from anyone that's visibly sick. And I did say, even those with just with allergies, you could be COVID negative and or COVID positive, but be asymptomatic, have allergies and sneeze. You just never know. Bring sanitizing wipes. Make sure they are the antibacterial sanitizing wipes, not just the ones that you get at the barbecue joint to clean your fingers. Some ideas are to wipe down the seat, the armrest, the headrest, your tray, your sidewall if you have a window seat. Use a tissue to open the lavatory doors. Bring your own food and beverages with you. Again, hand sanitizer and masks. Of course, there's entrepreneurs everywhere. So people are now selling airplane tray covers. And you can even buy phone chargers that also is a sanitizer. You put your phone inside a device and it charges it and sanitizes it at the same time. There's portable toothbrush sanitizers. And technically a longer flight, yes, you do pose a little bit greater risk because you are in a contained environment longer than on a shorter flight. But then again, with going through these protocols, you will reduce your risk for flying. Another change in flying you'll find, airlines have definitely been reducing what they are offering on a flight, and it's even more so now. So for short flights, you'll get a sealed non-alcoholic beverage upon request if it's even available. There's a lot of short flights where they're not giving you anything. If you're lucky and they have a snack, it will probably be just one of those Cheez-Its, pretzels, or a cookie. And alcohol service will most likely only be in first class. For longer flights, and this is, I should say, domestic flying right now since we're really not doing international flying. For longer flights domestically, you again would get a sealed beverage and a limited snack or food option. And again, alcohol service will probably only be in your premium seats or in first class. So if you have to fly, check what the airline will offer, but definitely plan to bring your own food and be mindful of those smelly foods. And you cannot bring your own alcohol. Moving on to hotels. Hotels, face masks again. Hilton Worldwide, Hyatt, IHG, Marriott, all of them, they're all requiring masks in public areas. We talked a little bit about this before in technology, that there's online apps for checking in. You'll see acrylic dividers at reception desk, concierge, use of apps in the elevators, and they will be constantly cleaning. Just like in the planes, there's electrostatic, the foggers that cleaning inside the planes, the hotels. For a while, hotels were leaving rooms empty for a period of time between guests to allow for any of the virus to dissipate. And but right now, since hotels aren't very full, it's easily done. If for some tips to bring you some comfort in a hotel, again, pack those travel size disinfectant wipes. Wipe down your light switches, your lamp switches, your doorknobs, your sink and shower handles, your toilet lid, the flush handle. You may see in hotels now that the remotes are cleaned and they might be packaged in plastic with a little note saying that this remote was cleaned. They're going to that extent to make sure that you are more comfortable in the hotel room. Do not use sanitizer, any of the chemical sanitizers on your drinking glasses or your ice bucket. You don't want to use any of those chemicals on anything that's going to be put by your mouth. So just use soap and water to clean those. And definitely use the plastic liner with your ice bucket. Those are notoriously very dirty. And then of course, use your own water bottle when possible. And be careful if you're refilling your water bottle, you want to make sure that that top of your water bottle does not touch any of those little nozzles at the top of whatever you're using to refill it. Keep that down a little bit and just don't touch anything. Moving on to attractions and public transportation. The big thing is pre-planning is a must. Know where you want to go and check the times and regulations and make sure they're open, because a lot of places are closed or they have reduced their times. You'll probably get a ticketed and timed entry. So that's another reason for pre-planning, is because you'll have a ticket to go into an attraction at a specific time, and this is for physical distancing requirements and capacities. Again, masks, you will see requirements for those. Public transportation, it will be different everywhere you go in this world, but at minimum, I say bring a mask, bring lots of patience, and bring some hand sanitizer. And then again, use your travel professionals, because they will help you figure out what's the best way to travel. In terms of group touring, because that's what we do here at the Alumni Association, tell you the update on what we're seeing and what's happening. Group sizes are being reduced. You're looking at more averages of about 10 to 24 for a group, which is great. I love traveling in these smaller numbers, and that would be a 24 would be, you know, a capacity, a tour at capacity, which on average you might see more around 12 or 18 or so. Tour buses, you'll see a large bus for a small group. It'll be cleaned nightly. You'll have limited seat rotations. One example is one of our tour providers, Orbridge. They are running tours into our national parks. The national park system has a limit of 10 people per bus. So they had a 50 passenger bus for every 10 people. So you'll definitely are going to be spread apart. Information, if you've been on one of our group tours before, a lot of times we'll pass things around the bus, either to sign up for a meal or something to look at or a map. That will now be on your TVs. So we'll be sharing that type of information on the bus TVs. If you have to sign up for a meal choice, we'll be doing those at a different time at a meeting point, maybe in the morning or at a previous dinner. Your dining experiences, you'll be spaced out, much like you're having if you go out to dinner here. You'll be spread apart and grouped by household. Most likely you'll be pre-ordering your food, and no open buffets. The audio headsets that you would wear on tour, they'll be cleaned between uses. If you even give them back, most cases you have one audio headset, you'll have it for the whole duration of the trip. And then of course, at the end of the trip, they'll take it and clean it and make sure it's sanitized if there's any reusable parts for the next person. Again, masks, physical distancing everywhere you go. And then time frames. There will be more strict timelines because of those ticketed and timed entries at locations. So you will be having to follow more of those stricter time frames. Here are some pictures of how people are dealing with this physical distancing. This is a group at the World Trade Center in an elevator, and then dining here in Thailand with plastic dividers between groups. And then we see this a lot in the United States, at least where we are, the painting on the ground to show where to stand and where to wait to make sure you're staying apart from each other. I love this. I wish actually we had these all over Corvallis, especially with our rainy weather. But in Amsterdam, they installed these really great little greenhouses for dining, and I think they're wonderful. I hope we leave them up forever. And then this got a lot of play on social media, where these teddy bears helping with physical distancing, and a variety of different restaurants and organizations are doing this. They might be using mannequins or cardboard cutouts or other stuffed animals, but it's just one of the other tricks for keeping people a little bit further apart. Got one more poll here, and I would love to know, because cruising has definitely been in the news. Would you cruise in the next 6 to 8 months? So I'll give this a minute for folks to answer the poll. I'm a big fan of HTV's Love It or List It. So this is a spin-off from the TV show Love It and List It. In terms of love it, yes, get me on a boat as soon as I can. Leave it, no thanks, never again, not for me, or list it. It's on my bucket list, maybe for another time, possibly when there's a vaccine or a better treatment. Um, it's interesting. We see in the cruising world, especially when I'm watching these news and watching different conversations on social media, there are cruisers and non-cruisers out there. Okay, we're done with the poll, and I think the results are probably showing that we have a pretty good mix of listing it and leaving it. And then we definitely have one person that loves cruising and they're ready to go off whenever they can. And actually, I see that a lot. I see a lot of it. Um, Cruise travel. So this is where we are with cruise travel. In a way, I think cruises are our guinea pigs of group travel. There really is nowhere else that no other environment like a ship where you bring hundreds of people together or even thousands on some of those really large ships from all over the world in such a small geographic footprint. If cruise ships can figure this out, then they might be the ones that find that golden ticket. The really hard thing is that not only do all the employees, but also all the travelers, I mean, everyone has to definitely adhere to strict protocols to make cruising work. You will see COVID testing before and after, before you leave, and maybe even COVID testing when you arrive to your first port and get tested again. You'll have daily temperature checks on the cruise ships. You'll see restrictions on excursions. So a lot of times, especially if you travel, where we partner a lot with Oceania Cruise Lines and Go Next, where they do have their approved outings, and then they also give you the ability to go off on your own and pick whatever you want during the day. That might be strictly limited. They're starting to do it. They're starting to say only excursions that are approved by the cruise line are allowed. So that is a big difference in cruising, and something, if you do want to book a cruise, ask that question about excursions. Capacity limits on board the ship are definitely will be lowered in the venues and the restaurants and the ship in general. They're going to keep the numbers down. Masks in public areas. I would say be prepared for possible misports and itinerary changes, just because everything is so fluid right now. And that is what we saw in the last few months. And you all, I'm sure, saw it in the news, how cruise ships were just getting turned around from port to port. The cruise industry has had a very tough start. Uncruises Adventures, they're one of the first cruise lines to resume overnight cruising in the US, and they had to quarantine almost right away. They had a passenger that tested negative prior to embarkation, but when they got to Juneau, they tested positive. And so everyone had to be quarantined in Alaska. Hertigan, Paul Gauguin, and a few others. I was stumbling on one of the names of the foreign cruise ships. They've all have had cases on board, and they've all have had needed to quarantine. Some I've heard rumors that there have been some successful small cruises lately, but it's still pretty hard. And then going on for cruise travel, we just hope that they'll get it right and hopefully soon. So now we're going to move to trip insurance. So remember, in your Q&A box at the bottom of the screen, you do have Angel, Myron, and Karen there, and they can answer any of these trip insurance questions that you might have. And another note, on the OSU My Travel website here, I have on the sidebar on the right hand is a link to USI Travel Insurance Services. That's to their website, as well as USI did a really great webinar just on travel insurance, and there's links to that webinar there that you can view, and there's also PDF of those webinar slides. If you don't want to watch the full webinar, you can just download those slides. There's also the COVID-19 travel insurance FAQs page that we developed in partnership with USI, and I'll send those out as well after this webinar, so you have a copy of them. So for trip insurance, there's a few phrases that you'll hear a lot. One of them is trip cancellation and cancel for any reason, or in the industry, we call it CFAR. So you might hear that term CFAR or trip cancellation. What's the difference? Trip cancellation insurance is insurance that allows you to cancel your tour before you leave for approved reasons, such as an illness, an injury, a death of your family member, a strike, a natural disaster. Some of these larger major issues, they'd be covered with general trip cancellation insurance. CFAR coverage, or cancel for any reason coverage, allows you to cancel a tour for basically any reason. If you're just too scared to go, or things have changed, or you've changed your mind and you don't want to go anymore, that's what CFAR coverage is. There is stipulations. You have to purchase it. It's an additional cost, and you have to purchase it within 21 days of your initial trip deposit. And that's if you're using USI Travel Insurance, our preferred insurance provider. Other insurance policies might be as low as 14 days. For you to purchase that CFAR insurance. So if that's important to you, you definitely have to look into it and purchase it right away. And the benefit pays up to 75% of your prepaid non-refundable trip costs. This document I have that I'll share with you will go a little bit more into the nitty-gritty of what this all is, and I'm just going to do a quick overview on some of these. Trip interruption and interruption for any reason are also terms that you will hear. Trip interruption is just that you were on your trip and it's interrupted and you have to go home for some reason. Basic trip interruption usually comes with a standard coverage that also has trip cancellation insurance. And it'll again cover those things. You happen to be on your tour and you get sick, or you're on your tour and there's an emergency at home and you have to go home, or you're on your tour and there's a hurricane. Interruption for any reason might be you're on your tour and you've had enough and you need to go. So the specifics of it, you have to read your plan, know exactly what's covered, but those are some of the terms you'll hear. Pandemics and travel insurance. This is also another question we're getting a lot of. Are pandemics or even COVID-related illnesses considered a known event, and therefore they excluded from your travel insurance plan? Be sure to ask your travel insurance provider that question. We offer select plans. They're called select plans under USI Travel Insurance, and COVID-19 related illnesses and quarantine may be covered with proper diagnosis and documentation, meaning you have to have all those doctor's notes with your diagnosis in order to be reimbursed for those for that circumstance. But that is a really important thing to ask. As well, another question we get is, should I cancel my tour or should I wait for the tour operator to cancel? It's a big difference. If you cancel your trip out of fear of going, or you choose just not to go anymore, a typical travel insurance will not cover that cancellation unless you have CFAR, or cancel for any reason coverage. If they cancel your trip, then you're in a better boat. So if they cancel your trip and they give you a full refund, then you actually can go back to your travel insurance company and ask to see and request for your policy to be refunded as well. If they cancel your trip and you get a voucher for travel, which we are seeing more than anything else, most companies are giving vouchers for future travel, then be sure to notify your travel insurance that your trip has been postponed, and let them know when you might be traveling again, because they'll just move that coverage to your new trip. Another one, can my trip, if my trip was canceled and I'm going to go on, it was received a voucher and I'm going to be postponed for a future trip, but now I want the cancel for any reason coverage. Is that possible? Unfortunately, no. So if you're using a voucher for a trip, that you cannot add on cancel for any reason. That cancel for any reason coverage, the CFAR coverage, had to have been purchased within that window when your initial deposit with your original departure, not your moved departure. But if you didn't have insurance before and you really want insurance now, you can get insurance. You just can't get the CFAR insurance. Quarantining is another question that we get, and quarantining, ask your travel insurance how it would be covered and under where in the policy, because when you read policies, you know, different stipulations cover different things. So depending on what your plan is, quarantining, or at least a portion of your quarantining, could be covered underneath trip delay, which is part of travel insurance on many plans. But then, you know, there'll be limits to it in terms of a max amount of money per day, or a max amount for the whole tour. So do look at that. And if you're traveling, that is a question that I definitely want you to ask all of your companies is, if I am quarantined, what are the policies? Is the travel company going to pay for that extra quarantine time, or am I personally going to have to pay for it? And I will tell you, in most cases, the travel companies will say that the quarantining will come out of your own pocket. For cruise ships, that might be a little bit different, because if you're quarantined on a ship, you're stuck on the ship in most cases, but definitely ask the tour company what their policy is around it. For the companies that we use a lot of them. You might have heard them before: AHA Travel, Odysseys Unlimited, Go Next. We are developing actually a website, web page on a website that'll help you get the links to be able to view all those different policies, because it is definitely important to look at. And will my trip insurance cover me if I get turned away at the airport because I choose not to wear a mask? No. If you decide that you don't want to wear a mask and the airline or the airport says that you can't be there, your travel insurance will not cover you for that. And one other thing, this is another question, is major itinerary cancellations. A lot of times, major itinerary cancellations, like closures of an art museum, and if it's the motivating factor for you to be on that tour, they could be covered. So definitely ask for that. And another last one is, has the typical travel insurance policy changed due to COVID in any way? And will there continue to be exclusions for pandemics or viruses? And right now, ours have not. The USI travel insurance policies, the select plans, have not changed due to the pandemic, but I have heard that other plans have been. I have also heard that there are other insurance companies that are no longer offering cancel for any reason coverage. So be sure to ask that question as well with the company you choose to go with. And don't forget, travel insurance is for domestic trips as well. So travel insurance can help cover all those domestic tours. There is a plan with USI travel insurance called a Voyager plan. If you travel frequently, when things get better, you can buy an annual plan that helps cover some medical issues. If you're not worried about the cancellation part of travel insurance and you're really only worried about the medical part, then the Voyager plan might be a good option. So this presentation will have hyperlinks to those Voyager plans for you to look at if that's something that you're interested in. And then moving through for some travel tips. For traveling, you definitely want to ease into it by staying local first, and obey all those local regulations and respect the wishes of those in the area in which you're traveling to. I was feeling a little cabin feverish and wanted to get out and maybe go to the redwoods in California with the family. And then I started diving and looking at all these websites, and all I saw all over was stay away. So we decided not to go. But definitely don't go if they really don't want you there. And if you're not supposed to leave your region, if like in Oregon, we have phased openings. And if you have a phased opening where you're not supposed to leave a certain area, of course, we suggest to stay where you are. One thing I'm working on, which you'll hear a little bit about in the future, and I'll definitely post it on our Facebook community page and on our website. I'm working on a project right now. It's called the Travel Oregon Project, but it'll probably get a better name. These are different sites and places around Oregon that are OSU alumni connected. So places for you to visit that have roots and connections to Oregon State University, as well as I have a picnic picks document. So if you're traveling around the state and you need to pack a picnic basket, I have a document of all sorts of OSU alumni owned and or we've done a lot of research with them, products to buy and to fill your picnic basket. So look for that in the coming future. I've mentioned before to do your research and look for those flexible cancellation policies. Many of our tour companies are changing them. They used to be final booking deadlines were 120 days prior to departure. They have now moved to maybe 95 days prior to departure to even 45 days or less prior to departure. And they're allowing cancellations with no penalties in some cases. So if you really want to get out, look at those cancellation policies, especially if you have little to no risk, or you could move your trip to another time. It's great news for our industry. Definitely another tip is you might find a good travel deal right now, but don't expect it to last. I mentioned that before. We are anticipating prices of flights and hotels and everything just to go right back up. Of course, if you feel sick, please don't go anywhere. I did put in there to prepare for a 2-week quarantine. I mean, it is worst case scenario, but I think it's really important, especially if you're going somewhere now, then prepare for a 2-week quarantine. And the last little tip is to clean your suitcase. I never really thought of it before, but definitely vacuum out the insides and pockets and spray down the outside, and don't forget those wheels because those suitcases see a lot of places that we don't. Now we're going to open it up to question and answer. So if there is any questions or big questions that we want to pop in, we got Angel, Julie, Myron. Any questions out there? Go ahead and open your microphones.
Hi, Kate. Can you hear me? It's Angel.
Yeah, you're a little quiet. Could you try speaking up a little more?
Okay, I moved my mic up closer. Is that okay?
Yes,
Okay.
that's great.
We do see a question here. Does the C4 plan exclude pandemics? Well, just want to make clear that the cancel for any reason option is precisely for that, to cancel for any reason, regardless of what it is. Just one of the rules would be doing it 48 hours prior to your departure. So if you decide not to go 24 hours before the trip, then unfortunately the CFAR will not cover.
Good question. Julie, do you have any big questions that were popping through?
I don't think so. There was a question about future trips. Kate, I don't know if you can speak just generally, but we're doing as trips come online into the future, if they are canceled, we're just letting folks know as those occur, correct? There's no blanket cancellations.
Right. Yes. So what companies are doing is they're taking it month by month. So with a little bit of hope that we can get out there, you will see on our website that I do have tours posted for potential departures in October, November, December, January. And honestly, we have hardly anybody booked on those tours at this point. And they're up there as well as if things do open up miraculously and it is safe to go, and we can allow for those last minute bookings, it could be an option. But if I have my crystal ball, I don't really see a lot of traveling happening until next year. I mean, spring next year. What you'll see, what we're doing now is we had some tours slated for 2021 in January, February, and March timeframe. We're actually starting to move those back into the fall. A lot of the reason behind that is one, no one's looking to book trips right now. So we're just not marketing them and no one's booking them, and it's not worth having them out there. So we're pushing those back to the fall. And we're spending a lot of time, I am starting to spend a lot of time on trips in 2022. So if you have ideas or places you want to go, don't be shy. Let me know, because we are looking at tours in 2022. A really great trip. We're hoping that might be able to go in 2021. We have a provider, Gia Ventures. You may have heard them in the news lately. They've done a lot of really great work with local communities, with traveling with diverse audiences. And we have a wellness tour to Bali that I hope might be able to go in the spring, because that is one of the things that people are looking for. But if not, we'll move it to the fall or another time. Bali, you can go anywhere. So we're being as flexible as possible
I
for
have
those types of tours.
another question, Kate. This may or may not be one we can definitively answer, but it's about coughing or sneezing on clothing. I know as caregivers are out there, they are definitely changing their clothes. As soon as they come home, they take a shower, they put those clothes in the laundry. So I would advise the same goes for your clothes that you travel in on an airline. For example, I mean, if someone unfortunately would cough or sneeze near you or on you, I would wash that article of clothing as soon as possible. I don't think there's a real definite answer of how long it can be on a piece of clothing, but it's not super long.
You know, that's really great advice. I would do the same. I would actually pack a spare outfit in my carry-on, and then as soon as I got to my final destination, change my clothes.
Yeah, that would be my thing.
I think that's a great idea. So we are running a little bit over time, as I tend to do. So I'll jump ahead and do one last thing. Here we've got our website, Travel Talks. You will find it at the OSU Alumni Association page. You'll go to Get Involved, and then there'll be a link for travel, group travel. And then on your sidebars on the side here, you'll see Travel Talks presentations, and a bunch of other fun things. So you can find us there. My website, my email address is right here as well. And then Facebook group, I mentioned a couple times, but we do have an OSU Alumni Association and Friends travel community on Facebook, so join us. And when we were talking about travel next year, we're going to do a 2021 online preview tour with 3 of our providers, AHI Travel, Odysseys Unlimited, and Go Next, and that'll be in the end of September. So look for that if you want to hear about some of the destinations. And thank you very much, Julie, Angel, Myron, and Karen, for joining us. I really, really appreciate it. And again, if you have questions, feel free to reach out to us. We're from home, but we're still reachable through the computer. So have a great day. Thank you.
Thanks, everybody.